When employees lack a real voice at work, it impacts staffing, which in turn affects patient care.
I feel the patient is just not getting the care that they should get from a hospital.
You're just like stacking treatments, and then going back and turning them off and putting somebody else on and turning them off.
Sometimes we carry 13 patients for one CNA. Sometimes 17 on the knock shift.
If there's any of my patients, my family in the hospital, I go in and take care of them because I know they don't have enough nurses' aides.
When they want to float you to the adult floor and you haven't given adult meds in 3 or 4 years, then you're putting the adults at risk.
They only say, we don't have a staff. Try to do whatever you can do. Try your best. Do your best. We can't do nothing. We don't have a staff.
Wake up before a disaster happens, and it's going to happen if you're going to have that many patients to take care of.
The hospital has to realize that everybody from housekeeping to the surgeon has their part in taking care of the patient.
In order to fulfill that responsibility to the best of our ability, I feel we do need to come together and support one another and have a voice in what goes on at the hospital and have a voice in staffing.
Workers have successfully organized and negotiated free and fair election agreements with nearly every hospital system in California, including Kaiser Permanente, Catholic Healthcare West, Daughters of Charity, HCA, and Tenet.
I think the opportunity to work collaboratively with labor to bring people into the healthcare system, to train them appropriately, and to give them jobs, as I said, with good salaries and benefits is tremendous.
In the contract, we have 3 different committees. One of them is Patient Care Committee. We have a voice. We can discuss what is the better way to take care for the patients.
This patient care committee that we have at Kaiser Los Angeles, this is the best thing that ever happened to me since I started working here 29 years ago. I'm telling you now, we need it. That's the only way for us union people to have a voice and to be really patient advocates.
Patient care is my number one concern and everyone's number one concern. We're getting everything we need to take care of all these babies, and that's what the union can do.
St. Joseph employees are simply asking for a voice in their workplace and that the hospital negotiate a free and fair election agreement that includes the right to choose a union without interference.
Los valores de cada uno de nosotros como seres humanos tienen que ser respetados.
We are adults. We can think for ourselves. We know the hospital. We love our jobs. We love our patients. And all we're asking at this point is for a free and fair election.
Half of their employees are already unionized. It hasn't caused the downfall of the system. They've moved ahead quite positively. Why are they so fearful of allowing the people that probably need more than anybody to be unionized, to have a voice, the service employees? Why are they fearful?
The main thing is just let us have our choice without harassment.
We're not doing this to make enemies. We're just doing this to better the hospital.
Patients ultimately will be the recipient of all of our efforts, and that's what this process is about.